the 2021 Community Forum here at Imagine. We have a responsibility every year to deliver an update on the activities of the community centered board to our community. And that is the purpose of this evening. And it's hard to believe that it's been a year since we did this last, and it was in a virtual environment in the early weeks of the pandemic. And here we are still in a virtual environment at the tail end, hopefully, of this pandemic. So over the course of the next hour, I have a few areas, few topics that we'll talk about. The first one is, of course, the impact of the pandemic on Imagine and our ability to serve the community. I'll spend some time talking about case management redesign, which formerly had been talked about as conflict-free case management. I'll spend some time talking about strategic planning, and then we'll leave some time at the end for questions and answers. Now, before we get started tonight, I would ask all of you to please join me in a moment of silence to honor and remember the 10 individuals who lost their lives in the Boulder shooting last week. This tragedy has reverberated throughout our community, shattering far too many lives. So I'm going to pause here and we can take a moment. Thank you for that. So, making the transition into the first agenda of the evening, just a few housekeeping items. Most of us have been doing this virtual environment long enough that we're well practiced with using the mute and unmute button, but if you're not, there's usually a little drop down in the corner of your screen where you can mute and unmute yourself. There's also a chat function where you are welcome to enter comments and questions throughout the presentation. I will tell you that my view, having the presentation up, it makes it difficult to see chat as they come in. So at the end, I will take a look at that chat box, but I invite you to contribute throughout if you'd like to. And then of course, if you have a question you'd like to ask, you can unmute yourself at the end of the presentation. So let's begin. Pandemic, it's been a year. Oh my goodness, has it been a year? I want to tell you that our number one focus this year has been to make sure that people are safe. And we have aligned our focus areas, our programmatic changes, all of the procedures, everything to be in close alignment with public health guidance and state rules to make sure that the people we serve and those who serve them are safe. I want you to know that Colorado has done a remarkable job moving quickly to implement flexible service delivery options, including virtual options, and expanding ways that families can use their funding to address situations that might be more unique because of the pandemic. And so Colorado has really been a leader in this area, and we're very grateful for that. And where safe and possible, service delivery and business operations have been primarily remote for the last year, since March 2022. And the state has given us very clear guidelines where we are to be virtual until they let us know otherwise. And a good example of that is case management. And they've given us guidance on where we need to be restricted in the number of people we serve per space. They've given us guidance over time on what can be virtual that traditionally has never been delivered virtually, such as some of our early intervention services and community services. Over the course of the year, in-person services have really been limited to employment, community, and school-age services in very small groups, all for the protection of people. There has been heightened risk management throughout the past year for the residents of our group homes because of the unique vulnerabilities of those environments. We all know by now that those the highest percentages of people who lost their lives in the COVID pandemic have been residents of congregate living situations, closer quarters, more people. It just created a space where the virus would spread more quickly, and so owning and operating a handful of those group homes, we were extraordinarily careful with how we supported those environments. We launched in-home one-to-one support for school day services, and I will tell you that throughout the year, while I'm very proud that I'm very proud of our staff, they really did everything they could to keep people safe. We were not immune from the impact of COVID by any means. We had multiple instances in community and employment and residential services at different times during the year where we had confirmed cases of COVID-19, and all of our group homes had an outbreak at least one time. And those outbreaks certainly happened during the worst part of the pandemic, which was in November and December. I'm happy to report that none of the residents that we serve in those environments have suffered long-lasting effects or lost their lives in that process. So thank goodness. The financial impact of COVID-19 has been significant. While the beginning of the pandemic, basically everything shut down, we were able to end the year in a positive margin. And at that time, Colorado passed a cut in provider rates, which between that and our anticipated reduction in the amount of service that we would deliver for the year, we had to make some pretty dramatic changes to our budget. We have qualified for direct and indirect CARES federal relief funding for COVID-19 related expenses and reductions in revenue for this fiscal year, which has helped us keep things going and keep our organization in a financially healthy area. And as we look ahead to hopefully the tail end of this pandemic, we continue to very closely manage our resources so that we can get to the other side of this as intact as possible. And on the other side of this, moving toward life after COVID-19, our primary focus at this point is on vaccinations. We are, at the beginning of the vaccination rollout, we were able to vaccinate all of the residents and their staff in the congregate living environment of the group homes under what at that time was 1A. And then with 1B, we helped connect caregivers to vaccination appointments if they were having difficulty doing that. And now the next big step is in a partnership with the ACL, we will be hosting mass vaccination clinics for up to 1,000 people. And those are going to happen on April 2nd and April 16th at the Boulder County Fairground. I am just so grateful for the wonderful partnership that we have with Boulder County Public Health and the Association for Community Living, the advocacy organization for this community, to do what we can and what must be done to make sure that people with intellectual and developmental disabilities are not left behind in the vaccination effort. We all know that the pandemic has uniquely impacted the people we serve. And I had very real concerns that as the vaccination rollout continued, with all the difficulties with understanding what's going on, the websites, where to sign up, how to get to the appointment, which appointment, and just so many challenges. I felt that it was really important for us to try to work with our public health partners to create targeted clinics specifically for those that we serve who need that kind of environment to make sure they get their shot if they want the shot. So I'm thrilled that this is happening. The first one is on Friday, and then in 2 weeks, we'll do the second one. And then of course, a month from now, bring those bring those guys back for their second dose. So just a wonderful, wonderful thing. And then, of course, we will continue to closely monitor changes to rules and regulations around resuming in-person service delivery. So this impacts what we are able to do in terms of when we can wear masks, when we are able to deliver services, not wearing masks, social distancing, group sizes, transportation. We know that people are eager to get back to a space where we can resume activity as normal, and we are just as eager as possible. We will do that as soon as possible, and as soon as the state gives us those guidances that it is safe to start making some of those changes. And then, of course, continued lobbying for restoration and cuts to funding that have happened, and that was that 1% last year. I'm happy to say that at this point, the budget for this next year at the state level includes a 2.5 provider rate increase, which is great. That those dollars are needed and will help try to rebuild some of the infrastructure that we had to pull back on to get through the pandemic and get services back up and running as soon as possible. Okay, so shifting to a completely different topic, case management redesign. If you joined me last year or you've been joining for many years, you've heard this conversation, you've heard this topic introduced as conflict-free case management. This has now been renamed case management redesign, and I will tell you why. To just take you a little bit of, take you back on a little bit of history, back in 2020 of February, the state announced their plans to implement case management redesign in Colorado. And they wanted to do this because at the time, the state of Colorado had a plan to create, to come into compliance with conflict-free case management. And they didn't like the plan for a number of different reasons. And so they felt that by shifting gears and going in this new direction, they wanted to take advantage of the opportunity to redesign and rebuild a better system of supports for people that isn't just compliant with conflict-free case management, but it also was a better system of supports. And so what that meant is all of the plans that we had up to that point in time no longer were valid. Now, this was announced by the state in February of 2020. And then, of course, the pandemic hit a few weeks later. And so this conversation was very much shelved for the most part ever since then, until January of this year. And in January 2021, Healthcare Policy and Financing, which is our state partner, they brought on board a consultant agency called HCBS Strategies. And HCBS's strategy's job is to lead the effort of implementing case management redesign in Colorado. And part of that process has been legislative. And so there's a policy, there's a bill right now making its way through the process called House Bill 21-1187. You can look it up. If you want a copy of it, send me a note, I'll get it to you. And it's titled, this really long title, concerning the implementation of case management redesign to ensure conflict-free case management for members eligible for long-term services and supports under the Medicaid program. Whew, it's a mouthful. And in this bill, there are a number of things outlined, and I'm going to call them out for you in the future on the next slide. So the first one is that this whole new system needs to be in place by July of 2024. So that's not a lot of time. That's right around the corner. And by the end of this calendar year, the state will have created, with the help of the community, a clear timeline for implementing all of these changes. And then by the end of next calendar year, 2022, they will launch a competitive RFP process in order to select the new case management agency. This bullet is really important. What this means is that every organization, any organization that wants to deliver case management under this new model as this case management agency or a designated area will have to compete to win that contract. That's a game changer. It's a really big game changer. I like this slide because this is not my slide. This is a slide from our state partners, because it lays out sort of their high-level vision for what they're trying to do with case management redesign. On the left, it talks about programmatic and policy changes that they want to make by summer of 2024. And on the right, it talks about some of the more operational changes, and they call it infrastructure, the day-to-day experiences that people have within the world of case management. And so walking you through this, what they're trying to accomplish is a system that has fewer doors for people to go through, and it's easier for families to navigate. They want to create a system where individuals' goals are the focus of the conversation, as opposed to what's available in a funding program, a waiver program. And they're trying to increase consistency, accountability, and quality across all of the different parts of the system. And the way that they want to do this is to create new data system for staff to enter and retrieve information from. They want to create a more person-centered support plan and assessment process. And they also want to create a more person-centered process for creating budgets for people to use when they're building out their plans of care, which, as you all know, is a really, right now, it's just a very unpleasant, to say the least, process for families to go through. And that's called the person-centered budget algorithm. So going back to the bill itself, House Bill 21-1187. So there's a lot of things in this bill. I think it's 75 pages long, something like that. And these are some of the highlights I thought I would pull out for you tonight. So the first is that the community-centered board designation, which is what Imagine has, along with 19 other organizations in Colorado, will be continued through a definition called entity. And what this means is that the state is trying to create some flexibility for organizations to continue to apply for the CCB designation. And it could be the case management agency. It could be just a standalone community-centered board. And the reason this is important is because there are some functions that the CCB provides the community that are really important. And we want to make sure that that bridge and that bridge is not lost in this redesign of the system. So there's just some flexibility built into the language. This bill creates a statewide case management system that will serve all people who qualify for long-term services and supports. And what this means is that where today Imagine and other CCBs deliver case management only for individuals who have an intellectual and developmental disability, and other organizations like Adult Care Management, Inc., they provide case management for individuals who don't have an IDD, they have other types of disabilities. The state is imagining that there would be one case management agency that provides case management for all programs, not just those who have an IDD. And while that may be efficient in some ways, the risk that it bears, I believe, is that it strips organizations of the inherent specialization that comes with being designated to serve only those with an IDD. And so it's really, I think, important that organizations, as they move into this new space, have strong plans for retaining that specialized knowledge so that we can still provide strong services to the different subsets of the population that we serve. And then just some other little details here. The case management agency can be a private or a public, non-for-profit, or a for-profit organization. The state is to work with the community to try to define service areas across the state. And I'm going to come back to that one, because that one's also really important. This bill also has some language in there that will allow some parts of the state to get a waiver, essentially, for being obligated to implement conflict-free case management, because the area is so rural. There's nobody in that area that would be able to pick up that service and continue to serve individuals. And so if you have some friends or coworkers on the western slope or the eastern plains of the state, and you know, a few years from now they're not having to make some of these radical changes, it could be that these areas were able to qualify for a rural exemption. So within the case management agency itself, a lot of the functions are the ones that you see a community-centered board do today. So that's the IDD determination, the assessment and intake process, developing the person-centered support plans, providing information to those on wait list, maintaining records, having a board of directors oversight, and so on and so forth. Within this bill, the language is flexible in that either the case management agency or another entity, which if you recall on the previous slide, the definition of an entity could be a CCB, okay? So either the CMA or another entity, could be a CCB, will be the early intervention provider and broker for a community. So this map is a map of Colorado regions, counties specifically. And the lines that you see drawn on this map, this is a map that was created by the state. What this shows you are some of the catchment area, the areas of service by designation in the state. So I'll call your attention first to the red lines. What the red lines do is they show you the geographic areas related to the community-centered board catchment areas. And so you can see right there in the middle, we've got Boulder and Bloomfield, okay? It's kind of hard to see Bloomfield, but that's one circle there. And then you can see that the different colors represent the single entry point catchment area. So those are the areas that are served by non-IDD waiver case management organization. So in our community, that's Adult Care Management, Inc. And you can see in our area that is Boulder, Bloomfield, Gilpin, Clear Creek, and Jefferson. I don't know why that's green, not blue, or blue but not green. And then the gray areas show the regions where there's some overlap. And what you can see here, just by taking a step back, is there's not a lot of gray area overlapping. Going back to this slide here where I talked about case management being a statewide system that would serve all those who qualify for long-term services and supports. This map is really important because in order for the state to implement this, they have to redraw the catchment areas. And there is active conversation going on right now about potentially new service areas of regions where there may be a multiple community-centered boards that will be pulled into that one area, multiple single entry points that will be pulled into that one area. We are getting some mixed messages from the state about whether there'll be more than one case management agency per region. Up until last week, the answer was no. We're all hearing that it's going to be one per region. And then after last week, now we're hearing different signals of, well, there might be more than one if a region has more than 10,000 people. So that's still really unclear. But what's important to know and take away from this is that this map is going to change. And so to kind of wrap it up in a bow, case management redesign impacts Imagine in a number of ways. So as you all well know, we provide both service coordination and direct service. So we have case managers, and then we also have direct service providers. After July of 2024, we will no longer be able to do both. I just mentioned that the service area of Boulder and Bloomfield counties may change as a result of the state's new service area map. So we're very much in the thick of that conversation now. In 18 months' time, we will have to decide if Imagine wants to compete to become a case management agency for a designated area. And another important thing to mention here is that specialized case management for those with IDD will cease to exist under the state's design. It will have to be managed at the organizational level so that we don't lose that level of specialty. All right, coming around to my last main topic for this evening, and then we'll take some time for some questions, is strategic planning for the organization. So here at Imagine, every 5 years, we engage in strategic planning roughly, and the plan impacts the entire corporation. COVID-19 did delay the implementation or the creation of a new plan. We were scheduled to do this last summer, but we were not in a position to do that. But we did successfully kick this off back in December, and we completed an internal scan. We're working with Social Venture Partners, and they are a wonderful consulting group available to support the nonprofit community in Boulder County. They have very smart people with a variety of business backgrounds, and they've been an excellent partner in this process. So we completed an internal scan of our strengths, weaknesses, opportunities, and threats. But we gathered that information to inform it, did the external scan, and then we compiled that all together to create the SWOT, which then went in front of the board and is now, and then it went in front of 5 different focus groups of employees at different levels of the organization. And I'll get a wrap up of that later this week from Social Venture Partners, which then we'll take that information into our actual planning session that will happen later this month. And over the next several months, the plan will be tied into a budget building process, and then we will publish it and go live with it, hopefully by July, if we don't have any unexpected surprises along the way. And just to give you a sense of some of the high level priorities that I anticipate we will spend time talking about, and I suspect will make their way into the plan. Obviously, the first one is we have to plan for case management redesign. The entire organization is going to change dramatically, so that's item number 1. I see a lot of effort. I expect there'll be a lot of effort talking about residential, because there is a significant lack of inventory of housing options and styles for people to choose from in this community. And so I think Imagine needs to be a part of that conversation in a meaningful way. I anticipate that we'll have a lot of conversation around recreating a vision for assistive technology and virtual reality as a complement to the services that we provide. And then we need to do more long-range planning for infrastructure stability. And this is directly related to workforce shortages that we not just have as an industry, but as a society. And then uniquely, the challenges created by the pandemic, coming out of the pandemic, individuals who are experiencing extreme compassion fatigue and vicarious trauma. We need to address that and help rebuild the infrastructure. All right, well, I got through this. My goal was to try to do this in 30 minutes. It's hard to sit through something much longer in a virtual environment. So I'm going to stop sharing my screen so I can get a chance to see the chat. And oh my goodness, I did not introduce myself. I am just looking at the chat here. My name is Rebecca Navinger. I'm the CEO of Imagine. Nice to meet you all tonight. Okay, so I invite you to share questions or comments in the chat, or if you'd like to show your video and unmute yourself, go ahead and do so. This time is for you.
I have a question. Can I jump in here?
Absolutely, go for it. We always need that brave first person.
I'll be that brave first person. My name's Carolyn Krozek. I am guardian to my sister, who has been with Imagine for, gosh, 15, 16 years, something like that. And she is in a unique situation that she does not reside in Boulder County, because we were unable to find, she's in a host home, and we were unable to find an appropriate host home provider in Boulder County. And so she actually lives south of Denver. And so, but Imagine has just done a great job with her care. And I'm interested in the changes that are coming and these new catchment areas and all of that. I'm curious how that would impact somebody like her, if it will. And I guess the other question is, it was hard to kind of take in all of that information with these new changes. And so I'm curious about, what does that mean for people who are in direct, in host home situations and in group home situations? How does this impact the folks that you serve?
Absolutely. It's a great question. And yes, it's a lot to digest. And it's one that I feel like you have to talk about 7 times before you really ingrain it. So very simply put, Imagine in July 2024, as its current corporation, will not be able to provide case management and direct service to the same individual. So if an individual receives case management from Imagine and also receives host home services from Imagine, then that individual will likely be in a position where they have to choose which part they're going to give up and move to a different provider or to a different CMA. I know.
That just seems crazy. It's interesting that's the solution, because it seems like having, I'm not going to change anything, but it seems like having kind of a one-stop shopping, seems like having all this under one roof has been the way to go. I'm curious what has prompted this change.
This has been, I think this is like an 18-year-old conversation at this point, conflict-free case management, back that culminated in 2014 with a federal rule that was passed by CMS impacting nationwide the delivery of services funded by Medicaid, saying that the same entity cannot provide plan of care services and direct services to the same person because of the risk of conflict of interest. And there are all kinds of, there are people on both sides of the fence about this issue. There are people who say, that's crazy making. I go to Kaiser, one-stop shop. What's the difference? And then there's people on the other side of the fence who say, this is appropriate because, there's a perceived risk of somehow finding more people eligible and self-referring back into an organization, and that's not good for anybody. What I can tell you is that over the years, there has certainly been a random concern or complaint brought up. And I say random because it's nothing that has ever been demonstrated by data collected by the state of Colorado to be a pervasive issue in the state enough to warrant a massive redesign of the system. The spirit of the community center board system for 50 plus years has been homegrown, local, small, well, now we've grown, of course, but, all under one roof if needed, choice, all the things. And we, along with many of our colleagues, we lobbied against this change for years because we felt that in the end, number one, it would disrupt services significantly and actually result in fewer choices for families. And we didn't think it would actually be a good thing to break apart organizations like this. The success that came out of that effort was really a delay of the implementation, but not a complete shift away from it. We will be the second to last state in the nation coming into compliance with this federal legislation. So we were successful in the sense that we delayed it long enough to maybe come up with a new model of supports. But I have more conversations with families like you who say this doesn't make sense, I'm worried about this, than I do with people who say this is a really good thing that's happening. So the challenge and the task ahead of us is to do this as gracefully and as eloquently as possible so that we minimize any disruption and harm for the people we serve. And that is the task ahead of us. And I will work very hard on that.
Thank you. Appreciate it.
Of course. All right, I see a question in the chat. If case management agencies will be able to offer enrollment into any waiver program, how does healthcare policy and financing, the state, anticipate addressing the DD waiver waitlist before and after July 2024? That's a great question. So there's a few layers to this question, a few layers to this answer. The first one is there is a lot of interest right now at the state level, the Joint Budget Committee level, to try to expedite the ending of the waitlist in Colorado for the DD waiver. Last year, there was a huge campaign, lobbying effort, hopefully some of you remember this, to try to push through the ending of the waitlist. And man, we did a good job. Like, we got really far, but in the end, right before the budget process for the state, COVID arrived. And of course, that changed everything, right? Because there were no longer resources to be able to do this. So that effort was shelved. But it wasn't for naught, because the effort and the energy that was put into raising awareness around how important this issue is actually led to a smaller cut in funding that I think otherwise we would have seen. Some budgets got cut 10, 20, 30%. It was just decimated. But IDD was 1%. So fast forward to this year, last Thursday, at the end of the budget building day for the Joint Budget Committee at the state, they authorized the passing of $20 million to take 520 people off the waiting list in Colorado. And that is wonderful. It's just so great, because it's been a long time since people were able to be taken right off the wait list. It's usually an emergency enrollment. So this is significant. It's a good step in the right direction. And it sends the signal, very clear signal, that our current elected officials in those positions at the state haven't lost their desire to move this forward. So long as our economy can support this effort, I think that we are on a path, and we have the momentum. I think we have the momentum now over the next several years to finally see that DD waiver waitlist fully funded. So coming back to your question, Jeff, there has not been conversation with healthcare policy and financing with the state, specifically with how the waiting list has any interaction with the beginning of new case management agencies starting July 2024. My hope and my expectation, I could be wrong, it all depends on the economic environment, is that there'll be some convergence of the two around that time. But I'm an optimistic person. But the signals are there. There's good signals. There's good signals. And if you're somebody who likes to write letters to your elected officials and let them know your thoughts and feelings and hopes and dreams, one thing that you can do right now is to write to the legislators on the Joint Budget Committee. If you want a list of those names and emails, send me a note. I'll send them to you, and thank them for the effort that they're putting into trying to end the DD waiting list with these 520 new resources that will be effective 3rd in July. And they'll be spread out across the state and different community centered boards. The last I heard is that every CCB should get at least 4 resources for their service area, and some will get many more. It just depends on the order of selection wait list. You're welcome. Other questions? Okay, well, that's all I had for you this evening. Let's see, on my presentation, I didn't, well, if anybody has any questions, you are welcome to email me. I'm putting my email in the chat. Don't be a stranger, you can reach out. Thank you for joining us this evening. Take care of yourselves and we'll talk soon.